I'm John Obie, and I'm from Jacksonville, Florida. I was actually born there, and it was actually when I was in high school that I realized that I wanted to go into medicine. I'm happy by nature. Every day is a good day, some are better. And I realized that I wanted to be in the medical field in a happy specialty. And fortunate for me, I was lucky enough to pick plastic surgery. I went to college at Mercer University in Macon, Georgia, and after that had the opportunity to go to Tulane University in New Orleans for medical school. When I think about why I went into medicine and what led me toward that, I would say part of it, certainly, I would give credit to my father. My parents always had a tremendous work ethic. In my father's previous experience, he had actually been a pharmacist and worked in hospital administration. And so I guess the seed of medicine was planted when I was a child. We're enhancing the patient's natural beauty. We're restoring them to a more youthful appearance. We're not changing who they are or how they look. We're turning back the clock. And it's exciting because it's so easily done for these patients. And the patients that we see are so truly appreciative of what we do. The more I looked into Lifestyle Lift, the more I met, if you will, the key management of Lifestyle Lift, certainly Dr. Kent and the excellent team that he's assembled. The more I realized that, you know, this would be a good opportunity. And a little over a year into it, you know, certainly there's no turning back, and I'm thrilled to be a part of it. In my spare time, when I'm not at Lifestyle and when I'm not in my private practice, I enjoy, I refer to it as holding sand down on the beach, reading on the beach, enjoying my family. I'm very much a family guy. And we've been married for over 30 years, have 4 wonderful children. And as any parent, you know, we've experienced the same growing problems that everybody else has. And to realize the importance of family, I think, is very important. I am truly blessed in every way, both professionally and at home. What's most important to me, both on a professional and a personal basis, is knowing that I did the right thing, knowing that I did the best that I could, knowing that I made the right choice, knowing that I did the best for my patients that I could. And there's a certain, you know, I guess, peace of mind that comes along with that. The thing that I would want patients most to know is that we're going to use all of our efforts, all of our abilities to deliver the best product that we can for them, and that we are there for them. If they need us, we're a phone call away at all times. And to that point, I tell patients that surgery is a relationship. And if everything goes great, it's wonderful, and sometimes there are bumps along the road and we have to work through those. And so it's got to feel good going into the relationship. And I encourage patients, you know, ask all the questions. Make sure that you're comfortable, that you know as much as you want to know.